Okay, real quickly, a review of the case study that was presented last week. First of all, the first thing that was missing from the majority of students, after going through 14 weeks and me having to explain over and over again, when asked to give a definition, it must include all of these components. It must include the disease itself, what causes it, the clinical manifestation, any labs and interventions. In this case study, there were several responses. I got responses such as hypertension, CHF, hypomagnesia, besides the point, renal failure, dehydration, and DKA. If your group had followed my instructions and you would have written the cause, for example, of hypertension, what is the clinical manifestations of hypertension, labs that are associated with hypertension, and interventions associated with the treatment of hypertension. You would then go back to the actual case study and see if your patient was presenting signs and symptoms of clinical manifestation of hypertension. You would then go and compare the labs to see if the labs responded to that hypertension, and then the interventions, then that would be right. In this case, hypertension was not the correct response, okay? Besides the point, actually, was the correct response with secondary to dehydration, all right? The patient was not DKA, because if you had done your definition of the disease, DKA is what and what causes it with clinical manifestation. In the classes, DKA was, I responded that D is for diabetes, DAB, ETS. That means you want to have blood sugars more than 250, but less than 600. Your patient did have the 300, I believe, 389. Ketones, okay, in the urine. There was no indication of that. He was acidotic when you did some of it, when you did your serum osmolarity, but the clinical manifestations did not line up. The lab values did not line up, okay? You must go through these steps. You can't skip it, all right? But here is what really, really bothered me, okay? Here, a 411 student wrote this. Chronic kidney disease, that's one of their choices. Chronic kidney disease was a choice that somebody, or a group wrote. This is what they wrote, is a long-term disorder in which the kidney does not function properly. 14 weeks, students, 14 weeks, okay? 14 weeks, over and over and over again. I said, you state the disease, what causes it, what is the clinical manifestations, your labs, okay? And then further on, the questions will start coming out of the interventions, okay? If this patient had chronic kidney disease, when you looked at the clinical manifestation, you go back to your case study and you would see that it did not line up. But first of all, this is not expected. This definition is not expected of a fourth year student, certainly not expected. This is another definition I got. Define the medical diagnosis. That was the question. Look what 14 weeks in class. 14 weeks in class. This is what I got for define the medical diagnosis. The medical diagnosis is chronic kidney disease. The word is define. What did I say about definition? Definition is state the disease, the cause, the clinical manifestation, and the lab values. That is how you define a disease, not chronic kidney disease. You would not get any points for that. So those persons who got less than passing mark, these are your reasons why, okay? Chronic kidney disease is defined as a kidney damage, is a damage to the kidney. That is what it is. Or it is a damage to the GFR. And then everything has numbers. I said that to you guys. Less than 60 mLs per minute for 3 months or more. That is what kidney disease is. The common cause can include diabetes and high blood pressure. Well, just say, for example, your patient did have chronic kidney disease, okay? Just say. There was no indication of high blood pressure on the diagnosis, none. Okay, so you would have ruled that out. All right, clinical manifestation includes weight loss, poor appetite, swollen ankles, shortness of breath, tiredness, blood in urine. None of those were in your patient's clinical manifestation. That is why it is so important, guys, that you write out your definitions. All right. As it relates to the ion gap, this is a response that I got from a group. The ion gap. How do you treat the ion gap? When dealing with azothermic state, the most important thing to do is to get the ion gap back to normal. That's the response I got from a 4th year group of students in complex nursing. What do you mean by ion gap back to normal? Okay. Even if I Google it, I would get a better response than that. Okay. If I Google the response, I would get a better response. What do you mean get it back to normal? There's no numbers in here. There's no time frame, no progression. All right. So for this group, you need to know what is azothermia. You need to know what is the ion gap. Vasopressin was another response. This is a response I got from 4th year students. It is an antidiuretic hormone, also known as vasopressin. Yes, we know it's vasopressin. Okay. It is an antidiuretic hormone. That's the classification. That's what it is. That is expected should the osmolarity be less than 240. No. Please, that group that did this, please go and look up your indications for vasopressin. All you have to do is Google it. It's there. Or if you don't have a textbook, or if you didn't read your textbook, which fluid should be given? This is a response that students gave again. If the patient is hypovolemic, IV fluid should be given. I asked which fluid should be given. This is a response I got. If the patient is hypovolemic, which by the way, in that particular group, they didn't even mention that was a diagnosis, but if the patient is hypovolemic, we're not talking about if. At the beginning, you gave me a definition of a disease, which was not hypovolemic, but you said if the patient is hypovolemic, IV fluids. What IV fluids? Is it lactated ringers? Is it normal sin? Is it D5W? Should be given. And Lasix should be limited. What do you mean by Lasix limited? Lasix come in milligrams. Okay, there's a number. Is it 6? Is it 20? Is it 40 milligrams? Numbers, guys. I'm saying it again. Okay, when I meet you guys in 412, when I ask you guys to give me numbers, this is what I'm talking about. Everything has to be defined. What is IV fluids? Another group answered administration. What fluid should be given? Administration of fluids. What fluids? What fluids do you give? Another question. Importance of monitoring electrolytes with insulin. That was the question. What is the importance of monitoring electrolytes with insulin? Here is what I got. It's critical to keep an eye on this electrolyte when taking it. I mean, come on, guys. That's the response I got. It is critical to keep an eye on the electrolyte when taking it. That's the response I got. Very, very disappointing. Priority actions when administering insulin drip. This was most disheartening when I saw this. Now, keep in mind, guys, there are several groups that did do well. Very good, congratulations. But the groups that are writing like this, you need to get down into your books this weekend. Priority actions from 4th year nursing students about to be nurses. For administering insulin drip is to ensure that insulin is not provided in a 2 centimeter diameter around the patient's umbilicus when providing insulin drip to this patient? That's a cut and paste. That's a cut and paste. Finally, I just want to say, for those groups of students that did get the actions for nursing action, I just want to emphasize there is a difference between dependent and independent actions. Your nursing actions for this student, for this patient, is to apply a cardiac monitor to the patient's chest wall. Turn it on. Get that rhythm. Analyze the rhythm. Initiate CPR. I'm prepared to defibrillate. So that means you're going to call a code. You're going to call a code. All right, that's the nursing action that was expected. You're going to administer the magnesium sulfate, which is a dependent action. Your dependent action with the 1, 2, 3 will save this patient life. This patient magnesium was 1.3. 1.3. The patient was outside for over a week, probably not eating, probably not drinking his fluids. Dehydration, secondary. So you want to begin your IV fluids, which can be your lactated ringers, then followed by your normal saline, if whichever one you can put your hands on, T5W. Apply cardiac monitor to this patient. That's what needs to happen when the same patient comes into the ER. Initiate CPR. Prepare to defibrillate. The nursing action is to call a code. That's what I expect from my fourth-year students. Quite a number of you did get it. Congratulations. The other ones that didn't get it, you have a lot of work to do. Please remember to prepare yourself to calculating drips and calculating IV fluids for your final examination. Thank you.